World Financial Group offers entrepreneurs from all backgrounds the opportunity to start their own business on a level playing field. Dr. Jana Woodhouse, receiving the WCM Wall Street Pioneer Award by the United Black Wall Street of America, Inc., is one of those entrepreneurs.
I see WFG and TFA as a place where African Americans with an entrepreneurial mindset can flourish. And the bonus, we help families and serve the communities across the country.
To learn more about us, go to worldfinancialgroup.com.
We are the sons and daughters of the soul. We are resilient and forever forward-thinking. We ask for nothing else than the opportunity to live and to create the lives that we were meant to live. We want nothing but an equal chance at options and possibilities. The same possibilities and options to live out our potential as our fellow man. We want to be heard, understood, and expressive in our reality. We are the future. We are the creative. We are here.
She was told that she couldn't play with the boys. She was told that they were too big, too rough, too strong. She was told to give up her dreams and move on. She was told to just be pretty, be quiet, be a lady. She was told that women had to stay on their side of the court, stay in your lane. Playing and competing with men was insane. She was told that men and women would never be equal. Dreaming like that would only be linked to your mind, to your soul. She never listened. She knew that their thinking was old. She is magic. She is the definition of spirit. She is what champions are made of. She is now.
Greetings and welcome to Access Wealth Nation with Dr. Jana B. Woodhouse, me. So you can have that checkup from the neck up and be able to do different, be different, and make a difference in your life. As you know, my philosophy is if you know better, you will do better. It's just important to have that knowledge out there. And unfortunately, in our world, we have not always been taught about financial literacy. So as you know, we have our book, How Money Works, Stop Being a Sucker. And if you'd like that book, you have to go to our website, or better yet, give a call to 646-375-2121, which is my office, because some of y'all are requesting this book and you're not giving us the address. It is a live physical book. And so therefore for you to get it, again, there's so many ways of which you can get the books that we have, the information we have. I have a website that just caters to financial literacy. It is wealthwave.com/Jana B. Woodhouse. No, just Jana B. We cut the Woodhouse. You know why? Because the name is too long. But anyway, it's yes, wealthwave.com/Jana B. That's Jana with the J. Okay, and we are being broadcast on the Soul City Network, and of course on WHCR 90.3 FM, the voice of Harlem. And so today I'm not taking a lot of time chit-chatting and talking with you guys. Y'all know the scope of what we need. If you want a free financial analysis, we'll be glad to provide it. You just have to give the office a call, and one of my associates would be glad to work with you. And some of you have really joined on board, and I'm very happy. I think we've made some differences. Of course, you can always reach me at Anaj Enterprises Inc. at gmail.com. That's ANAJ Enterprises Inc. at gmail.com. The reason why I spell everything, because WHCR also happens to be just a radio show, and we don't want anybody left out. That being said, I have one announcement that has to be every time I come on until January 1st, and that is the BOI .gov. BOI, no, it's FinCEN.gov is how you go to it. FINCEN.gov. You must, if you have an LLC, an S Corp, a C Corp, well, sometimes on a C Corp, you might be exempt. But if by January 1st you have not done the business owner's information regulation, you will be charged $500 per day as a fine. So it is imperative that you get in touch with your accountants. There are vehicles out here that will fill the form out for you. I'm going to tell you straight up, you can do it yourself, and it doesn't cost you anything to do. It is to identify who are the business owners, those who have an interest in the business, at least 25%, could be less, but 25% of the business, and you must identify yourself with your ID, which would be your state ID, preferably your passport. This is to make sure that you're not doing anything on a terrorist site. And you're not, but if you don't do it and you're not actively working your business, then therefore you might want to think and consider closing it so that you won't have to deal with this. But if you're going to keep the business active, then you fill the form out. You only do it once unless you change owners or information. At that point, you have to amend it and you go to the same site. So that's my little mark that I think everybody needs to know, because for some reason, people aren't talking about it, or they are talking and charging $450 to $1,200 to fill the 15-minute form out. I'm about really just trying to make sure people are within compliance on that. Okay. That being said, we were talking about Medicare 101 basics. As I've become an associate within the Medicare field, I have learned a lot. Number one, I learned specifically that when you turn 65, your world can change. And we're going to discuss some of the basic things that you need to know. Those of you who are out here, some of the things that you just need to know so that you can make an educated decision. So you know what I do, I go and get the expert. And the person who is mentoring me and has spent years in the Medicare field, in the HR field, understanding she has brought onto her business, which is Insure with Grace. I think I love it. I know I love it. I love saying it. I love being a part of her organization also. She's a great mentor and teacher. She also has brought financial literacy into her business and vice versa, and has become very, very successful. And now she's become a good, I always say there's a brother from another mother. Well, this is a sister from another mister. Okay. But we have really bonded, and she has assisted me in helping people do the right thing with their Medicare. And she is a Medicare specialist. She's phenomenal. If you have questions, you can put them in the chat. If it's after the show has gone off, you can send me the emails and I will be glad to address it. Good evening, Debbie. Good to see you here. I'm glad you're here. Get your questions answered. Okay. And so with no further ado, I'd like to bring on Grace Himmelright.
Hi, Jana. Thank you so much.
I
am very excited to be here. Very excited. I enjoy the show so much, and I share it with people. It is just such a resource, and I'm excited for us working together in the Medicare arena like we do in financial literacy.
Yes.
And, next year I'll be a grown-up in Medicare because I'll be at 21 years.
Wow.
So this year it's 20, but I'm happy to help anyone.
That is awesome. And your knowledge is astronomical. It is phenomenal. You have helped some of my clients as I'm getting through my lessons. You know, people know I've been in this industry for 40 plus years, but Medicare was not an area. And I was like, okay, let me do the Vanna and pass it on. But Grace really showed me where this could be done and be added to my practice. And I just am glad that I have this relationship. So we're going to dig deep right now into some of the things that I think people would like to know. And one of the things, okay, there's this whole thing, October the 15th to December the 7th. I had one of our mutual clients come back and tell me, he said, you know, December 7th is important. And I said, do you know why? And he said, no, it's just on the ads. So now we're seeing all of the ads that those of us who have turned 65 or those that are turning 65 have gotten an astronomical amount of mail. So what's the significance of this October the 15th to December the 7th?
Sure. Well, when you're already on Medicare insurance, so you've enrolled in Medicare and you're covered primarily using that insurance, this is your window. Just like when you were working and you had a window when you could change your insurance or your HSA contributions, October 15th to December 7th is when someone that is already on Medicare can make changes to their insurance, which then is effective January 1. So this is known as annual enrollment.
Okay, so this is just their window. But are there other dates that someone who, and I found out, y'all don't know it, but if you're doing Medicare, you are considered a beneficiary. Okay, you are benefiting from this service. So is there other dates that people who are beneficiaries can change?
Yes. So if someone is in an Advantage plan, and we'll probably talk about that if you'd like in a little bit, but if someone is enrolled in an Advantage plan, the second time they can make a change is January 1st to March 31st. That's called open enrollment, OEP. I sometimes refer to it as the oops enrollment period. Meaning maybe you didn't make the change that you wanted to. Life could have gotten busy. But if you're on an Advantage plan, you get a one-time change January 1st to March 31st. And all Medicare insurance starts on the first day of the month. So if you make that selection to exercise your right to change during oops enrollment period, January 1st to March 31st, it becomes effective on the first day of the following month. So now we're at April 1st. No fooling. Okay. We made our selection and here it is, April 1st. There's some other election periods where people can make changes. One of those is personal, just to them. And that is if they move. If they move into a different county out of their planned service area, because Medicare divides the service plans by county. So if you move to a different county, that could create your own special enrollment period. Okay. Or if you develop or you have a chronic disease, such as diabetes or cardiac problem, every month, if you're not currently in a disease special program of an Advantage plan, every month you have that opportunity to find a plan that maybe really suits your health conditions. And as long as you're not already in a plan for that health condition, then you can select that. Also, if you are receiving, say, prescription coverage because you've served our country and you're VA connected, as part of the country's thanks to you for serving in the military, and you have VA benefits and you're registered with the veterans for those health benefits,
Yes.
then you can change to a special plan that is called a Medicare Advantage only, because you're going to get your Part D, your prescriptions, through the VA because of your service connectedness.
Mm-hmm.
So that is the special enrollment period that could happen for somebody in that scenario. Okay. And then the final scenario that's personal, right? Personal to an individual is if an individual becomes newly eligible for help from the state through the Medicaid program.
Okay.
The Medicaid program has different names in different states, but predominantly it's a medical program that is for people that are financially fragile, that if they get help from the state would pay, for example, their Medicare premium. It would pay some of their medical bills.
Mm-hmm.
So if you're new to that program, you apply and you become newly eligible, then that's a special enrollment period. So those aren't date specific, Jana. They're special to an individual. In fact, we call them special enrollment periods.
Got it. Yeah, those are people who situations, life occurrence.
Right.
And that's important. And sometimes you just need to ask if it, especially what has happened here in New York, there are so many things. Like, for example, I know I referred to someone who was receiving benefits because of 9/11 and wasn't sure what to sign up for, because they do get, they get a medical, not necessarily the best, because it's good medical coverage. But the thing is that it's once a year. I think sometimes you need to have a medical more than, a physical more than once a year,
I agree.
Yeah, so that's it. Now, you mentioned something that was really the advantage versus the medical supplement plans. So can you tell us the difference? Because what they do on television, I know here in New York, is everything is, did you get the Advantage program? And it's like, okay, but no one's saying, well, how do I qualify? What is it?
Absolutely. So there is 4 areas that original Medicare doesn't cover. There's the Part A, which covers when you're admitted to the hospital. That's an easy way to remember Part A, admitted. There's a deductible, though, with Part A. So that is about $1,700. And what's unique about the Part A deductible when you're admitted to the hospital, it can happen every 60 days. So that could mean 6 times. Now, that doesn't happen often, right? But that's the reality. So that's the first area that original Medicare doesn't cover entirely. And that's the Part A deductible.
Okay.
Then there's medical coverage as part of Medicare when you're not in the hospital, obviously. That is covered under Part B, like boy, okay? So if you go to a doctor's appointment, if you have outpatient surgery, any medical intervention, and you're not admitted, that's covered under Medicare Part B.
Mm-hmm.
There's even some medicines that are covered under Medicare Part B.
Okay.
Just a few. So Medicare Part B also has a deductible, right? Deductible. We have to pay before the insurance pays. So the Medicare Part B deductible is once a calendar year, and it's about $240. After you pay that deductible, Medicare will pay, but it will only pay 80%. So we have our Medicare Part A deductible, our Medicare Part B deductible, and the 20% that original Medicare won't pay of any covered service, doctor's appointments, x-rays, CAT scans, lab work, right?
Mm-hmm.
So all of those areas, people look to get insurance. Now there's one other very important area, because there's 4 areas